On August 23, 2017, Rush University Medical Center in Chicago, Illinois, conducted a functional exercise whose purpose is to address the command-based elements of the receipt, triage, and care of radiation injury casualties in accordance with existing Radiation Injury Treatment Network, or RITN, plans and procedures. Particular emphasis was placed on coordination with the Chicago Federal Coordinating Center, or FCC, City of Chicago Public Health and Emergency Management, federal agencies, and RITN as it relates to communications, family assistance, resource needs, and patient care. This exercise was conducted as a follow-on to a tabletop exercise that Rush and RITN conducted in 2015 to demonstrate alignment with the building block approach of exercises. Functional exercises are focused on exercising plans, policies, procedures, and staff members involved in management, direction, command, and control functions. In these types of exercises, events are projected through a scenario with event updates that drive activity typically at the management or command center level. A functional exercise is conducted in a realistic, real-time environment. However, movement of personnel and equipment is simulated.
This exercise will be conducted in 6 very distinct modules, and some of them may overlap. Keep in mind that this process through the NDMS, or National Disaster Medical System, it takes some time for it to work where an event happens in a city and patients finally flow from that city to other cities and hospitals. So we're going to stage this exercise in long time phases. First module will be day 1, where an improvised nuclear device incident occurs, and we're going to address some initial briefings and preparations that you would conduct here at Rush.
Key points of this functional exercise included the following. 1. Command Staff Organization. The Rush team organized their team under the Hospital Incident Command System, or HICS. This system included an Incident Commander, Planning Section, Operations Section, Finance Section, Medical Technical Specialist from the Bone Marrow Transplant Unit, the Logistics Section, and a Liaison Officer. 2. Initial communications with external agencies. The Liaison Officer is responsible for exchanging information with agencies such as the Health Department, Emergency Management, RITN, and the Federal Coordinating Center.
Hi, Fred, this is the FCC. What can we do for you, sir?
3. Drug shortages. The improvised nuclear device scenario will create nationwide drug shortages. In this exercise, the Rush pharmacist assessed current stocks of Neupogen and other drugs necessary for a large influx of radiation injuries. In addition, the Rush pharmacist identified stocks of drugs available from the Chicago Department of Public Health and the Strategic National Stockpile. 4. Families self-transport from the affected city. RITN centers, such as Rush, can experience unannounced casualties that self-report to their hospital. In this scenario, there was a family of 5 who showed up at the emergency department, 2 of which required admission.
So we had 5 patients self-presenting to the emergency department with various symptoms: family, mother, father, and 3 children.
5. Command Staff Updates. Throughout this exercise, the incident commander from Rush worked with his incident management team to receive situational updates regarding expected patient arrival, resource needs, hospital bed availability, and public messaging. 6. Patient care. There were several radiation injury patients received in 2 waves from the National Disaster Medical System. In this exercise, the Rush bone marrow transplant team reviewed paper patient profiles to make treatment decisions, to include laboratory testing needs, drugs to be administered, and whether or not they would be treated as outpatients or inpatients. 7. Coordination for housing. This scenario involved families of inpatients and also outpatients who were medically evacuated from Atlanta. Thus, there was a need to identify housing for these patients in Chicago. As a result, the Rush team coordinated with emergency management and others in the simulation cell to coordinate these housing needs at local hospitals and a university. 8. Finance issues. The Rush Finance Section Chief conducted federal reimbursement actions for patients received from a national disaster medical system evacuation. In addition, there were other costs that needed to be tracked, including those for staff, equipment, and supplies to address a large surge of radiation injuries. 9. Worried well populations. Rush was challenged with an influx of people who were considered worried well. As a result, Rush worked with the City of Chicago agencies to develop effective messaging to ease the fears of the population and to minimize the impact on the emergency department at Rush.
I'm just going to bring the detector a little closer to make sure there's nothing on your person. I think you're all clean. Wonderful.
10. Hot wash. The Rush Incident Management Team and representatives from external agencies gathered to discuss what was learned from the exercise. The hot wash provided an opportunity for all to describe what went well in the exercise, but more importantly, to identify areas where Rush and their partner agencies can collectively increase capabilities to receive a large surge of radiation injury casualties. There were several lessons learned from this exercise that were documented in an after-action report that will be used by Rush to further develop their RITN plans. Now that Rush has conducted a tabletop and functional exercise, the next step in the building block approach for exercises is to conduct a full-scale exercise in the future.